My name is Dr. Aziz. It is exciting to know that health and medical care in Sudan is a priority and taken seriously by Sudanese doctors in the diaspora. Before listening to the doctors, I would like to introduce to you Professor Alam Ahmed, who has worked tirelessly to bring together doctors and the youth to talk about this important issue. Over to you, Professor Alam.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. I will just talk one line in Arabic and then I will talk in English. أنا بشكركم جزيلا كلكم. يعني this is our second event في specific debate. We call it Diaspora Youth Debate. And this debate initiated last July when we had a meeting here by at this university, which was the third actually international conference for the diaspora. And this is a project we started in 2009 at the University of Sussex. And many people have talked about engaging the youth, the young generations, in all global issues to deal with development, sustainable development, and sustainability. And we are very grateful. We have a partner here, which is the United Nations Major Group for Youth and Children, which is showing great interest in the work we do. So they are one of our major partners in this debate. The debate is not specifically academics, but more about policy. We are really keen on policy. And in this policy formulation, we are very keen to engage and include the young generations in the decision makings. So the United Nations, the World Bank are very keen to get the young generations, youth, involved in the decision making. This has been a major issue or a major trend in the policy and sustainability debate across both World Bank and United Nations. So we are very grateful I think we're very excited because we have 4 or 5 young, I don't want to call you young, but 5 very young Sudanese, British Sudanese and diaspora. This is the second one. The first one we had it back in, I think in January, and this is the second one, which is focusing on the health issues in Sudan. I will just quickly do one thing, which is this one. The partners who are organizing this event are the World Association for Sustainable Development, the United Nations Major Group for Children and Youth, and the Sudan Knowledge, which is the Diaspora Project, and the Middle East Knowledge Economy Institute, and the Center for Innovation Management and Enterprise, which is based here at the University of East London. I am based at the University of Sussex, where we look after the 3 Sudan Knowledge, Middle East, and the World Association. So we are very grateful. We also are very grateful for Joseph, for the media group. Okay. So this debate is going to run like this, just to quickly introduce what is going to happen. Those who are following us from the Facebook page, please continue, spread the word about the debate which is running now. We're going to watch and follow up all your comments on the Facebook. Please, at any point, if you feel the picture is becoming blurry or it's not clear, or if you can't hear us, please let us know, because we will be following this from the screen, from the backward. So if there's anything, let us know. We will take your questions. We will give them to the panel when the time comes. But please, if there's anything during the live coverage, let us know. The debate itself, as you can see here, I mean, most of you have already seen this, but it's a future direction of health and healthcare planning in Sudan. And this was a follow-up, in my opinion, to the first debate we had back in January, where Dr. Mayada talked about a whole system or whole approach to health in Sudan. And we had lots of interest and feedback from people saying they would like to explore this topic further, because our plan was to have a big debate on public health or the whole health system in Sudan for 2 days. But this is more of being an advanced workshop to try to address this issue. So as far as I know, this is quite new even in the UK. Dr. Mayada said this is not been tried before, and in her place, where is Birmingham, in Birmingham, this approach is being tried, I think, the first time in the country. So we're going to listen to her for 20 minutes. After that, we will also listen to Dr. Muna for another 20 minutes. After that, we will have question and answer. Or if we can manage the time, we might have the third speaker before we go to the break. So Dr. Mayada, I will give the floor to you. And because we have people watching us, Dr. Mayada, I don't want to talk too much about her because you all know her. But when it comes to public health, Dr. Mayada and Dr. Muna and Huda and all this health group, the Sudan Public Health Research Group, they are a group which started with us in 2009 when we did the diaspora one, and they have contributed to everything we have done. And I think your impact in Sudan is being remarkable. People have known about your work for a long time, all your group. So I will give you your 20 minutes, and the floor is yours.